Good afternoon, this is Dr. Doe again. This video is Quarantine Special Edition, video number 24. Today I'm going to talk about one topic. Everybody knows it, but I just like to specify and see whether I can explain to you about the cardiac test. What kind of test can be used to measure, to diagnose, or to diagnose or to exclude the cardiac disease, or to identify the severity of the heart disease. It's quite common. I'll start from the basic one, which is the blood pressure measurement. So blood pressure measures the flexibility of the artery, the blood vessel associated with the heart. Okay, so if the blood pressure is high, impose the risk for heart disease because the heart needs to work harder to overcome that resistance. So that's why the blood pressure is important. How to measure it? You know it on the brachial artery, and measure systolic and diastolic. The nurse and the pharmacy and also the automatic machine. So this is very easy, simple, straightforward. And the other, on top of that, blood pressure measurement, which is another common one, EKG, electrocardiogram. What does this EKG do? EKG measures electricity activity of the heart, the chambers, the rhythm, the rate, the heart rate, whether it's tachycardia or bradycardia, the rhythm, whether it's arrhythmia or normal rhythm, regular versus irregular, and the other problem, whether the abnormal, like arrhythmia caused by the ventricular cause, or the supraventricular cause like atrium or sinus node, something like this. So basically, I'm not going to talk about detailed on EKG, PQRST, the waves. They're reflecting the electricity of the cardiac muscles, which muscle contraction, which chamber is contracting, which chamber is relaxing. But from this EKG can tell many problems. So this is very important. What kind of indication for EKG? Anybody has history of heart disease, or you have feelings of heart palpitation or bradycardia, or like previously I mentioned, other symptoms of dizziness, blackout, lost consciousness, etc. It's a widely used, very fundamental test for the heart function, which is EKG. On top of that, sometimes the X-ray can give briefly idea about the heart, whether it's enlarged or whether it's not enlarged, or whether the pericardium has a problem, like such as fluid, etc., etc. Usually the chest X-ray not indicated for the heart test. It's just associated with the lung, or just if you have lung disease, or you have some unknown cause of shortness of breath, for example. Of course, we see the chest X-ray is the first line to do the test, and then by looking at that, briefly can tell whether the lung is normal, or the heart, whether there any large artery twisted or changed the position or dilated, or whether the heart is dilated, or just fundamental, not the not the first line or for the heart test, cardiac test. On top of these, EKG, blood pressure, X-ray, is the echocardiogram. This is very commonly used, very helpful, very useful, because it can look at the chambers and the valves, and the dynamically motion of the heart. How strong is your heart muscle, cardiac muscle contract? How's the valve function, and the affiliated structure along the valves, like whether there's a reflux or regurgitation or stenosis, etc., etc. So this is the cardiogram is very important, particularly, of course, because this is so detailed of the heart. Is not first line. It's not can be used test for everybody. There's a strict indications for this. For example, you're suspected to have valve disease, or you're suspected to have cardiac heart failure. So this cardiology can measure how is your left ventricle function, is called efficiency. How your left ventricle pumping blood efficiently. If less than 30%, for example 40%, then that indicating the severity, and some of the medications can or cannot be used. It's a direct guidance for the physician to diagnose, to prescribe medications. So this is very important. In between the EKG and cardiogram, there's another test. Because I put in the last, because this is have a lot of talk about that. It's called a stress test. Okay, who needs a stress test? What's the indications? The stress test, basically the idea is to challenge your heart, to see whether your heart can tolerate the stress. Those people had intermittent chest pain, blood pressure high, and the physician cannot diagnose whether you have angina, either spasm, or the blood vessel is strict, or is narrowed, or there's some problem for the coronary artery. So this is the indication to see whether there's any heart ischemic. This basically just use one word to see whether your heart can tolerate the stress without any sign of ischemia. So you walk on the treadmill and your heart rate increase pretty much 40 to 30% of your normal, more than your normal, and then doctor will take an EKG to look at whether there's any ischemic change after this challenge. This test is very useful because a lot of times, especially for diabetes patients, their sensation is not as normal people. They have the neuropathy. Even though they may have the ischemia, the chest pain cannot be felt or sensed like normal people. That imposes the risk to the severe heart ischemia. So that's why for those people who had shortness of breath, or obesity, or high blood pressure, and sometimes feel chest discomfort, this is the test to use. And of course, there are detailed guidelines, detailed indications for who needs to be undergoing this stress test. I'm just give you the idea how this test works and what is useful. And I hope that give you some idea whether when doctor talk to you, you need to have stress test, you understand what is the purpose, or you need to have EKG, understand why you have EKG. And so this is just the fundamental. Of course, there are some other high-level tests. Those are really for physician to make decision, like the imaging study or the cardiogram, etc., etc. But those are belong to the specialist. I'm not going to talk that, but these are blood pressure, EKG, stress test, echo are the very common and very useful. So I just bring here, hope it helps, and thank you for tuning in. I'll see you next time.